Where to start? First off, welcome back, y'all. I'm JessTheMD. Thank you so much for joining me. I have been away for a while. It's been a couple of months and I am so glad to be back. It's been a wild ride, guys. Let's start at the beginning. I put out a video on this last year, but I found out that I have a BRCA mutation, BRCA2 in particular. That was last June and pretty stressful to find out because of all the implications. Things like breast cancer, ovarian cancer, pancreatic cancer. It's kind of terrifying when you find out that you have a pretty high risk of those kind of terminal cancers. So I made the decision to have a prophylactic mastectomy. So what is that? That is removal of as much breast tissue as possible. Usually there's a small percentage left over, but it is the prophylactic removal of breast tissue so that the tissue isn't there to develop cancer. I breastfed both of my kids. I breastfed my first for 18 months, my second for 2 years. I produced a lot of milk. I donated a lot of breast milk to other moms and babies in need. My boobs did a lot for me. My boobs did a lot for my kids. My boobs did a lot for other kids. And I honestly, when I got that mutation diagnosis, I was like, yeah, whatever. I'm done. I don't need them. Take them off. It's all good. And then when it came time to actually do it, I was really emotional. Because they're a part of me and they did lots of work for me, and it was a lot. It was a lot emotionally, and just the change. They look different now. Anyway, I'll tell you about the surgery next. Bottom line, the whole thing was a little bit more emotional than I thought it would be. I was like, get rid of them. 70% lifetime risk of breast cancer. No, thank you. Just take them off. I don't need them. And then after they were gone, I was like, oh God, what did I do? Did I need to do this? Was this necessary? Couldn't I have just continued with screening? Yes, I could have. Could my anxiety handle that? Probably not. That was why ultimately I made the decision to have surgery. So really the options are increased screening when you know you have a BRCA mutation or any kind of hereditary cancer gene mutation, or removal of the offending organ if it's possible to remove, right? Like breasts, they're not essential for life, so you can take them off. So that's what I chose to do because I realized that I could not live with the anxiety every time after getting imaging, which can be even, every 6 months. I realized that I couldn't live with the anxiety of wondering what might be found every time. Basically, the surgery involves 2 surgeons. A breast surgeon that does the mastectomy, that goes in, cuts away all of the breast tissue, and then a plastic surgeon, if you want to do reconstruction, which I did, a plastic surgeon to do the reconstruction. So last year, when I got that diagnosis, I went to see a plastic surgeon, and she told me basically, after breastfeeding kids for so long, things were very stretched out and they needed to be tightened up if I had any chance of doing a nipple-sparing mastectomy. And that's what I wanted because that was probably what would give me the best chance of having a nice shape afterwards because I didn't have a lot to work with. And I'll explain that in a second. So I chose to do a deep flap reconstruction. Basically, what that is taking a flap of skin and fat from your abdomen with the vasculature included, moving it up into the breast pocket that's been emptied by the breast surgeon. When you do a mastectomy, you leave the skin unless there's a cancer that's invaded the skin or something that requires skin removal too. But really, the goal aesthetically is to leave as much skin as you can to make a good reconstructive appearance after. So I wanted to do the deep flap reconstruction for a couple of reasons. I wanted my own tissue as part of the reconstruction. I was thinking I probably don't want implants. I'd heard from people that had that kind of reconstruction that sometimes they feel really, really cold because you have just skin and an implant. An implant takes on the ambient temperature of the room, which is far colder than our body temperature, and then you just feel cold from the inside. And I am a person that's like always cold, so that was just not what I wanted to do. I talked to my plastic surgeon and she said, we'll have to do a lift first, get things all in the position we want them to be in, and then you'll do the mastectomy, have the reconstruction in that same surgery. When was that surgery? That surgery was in the middle of June. So it's been a minute since I've been in front of you guys. So I had the lift, everything was great, successful, everything healed up nicely. And 4 months later, I had the surgery that was like I said, this past June. This surgery was roughly about 10 hours, just a little under. And there were a few small complications during the surgery. My blood pressure dropped pretty dramatically during the surgery to like 80s over 40s, which is pretty low. And so there was some effort to get my blood pressure up, mainly because, well, survival, right? But the flaps, once they're attached, they need blood flow, right? The vasculature is attached here in the chest, and the flaps need blood flow. And if the blood pressure is too low, then it doesn't get enough blood flow. So the goal was to get my blood pressure up. So push fluids and all the things to make my blood pressure come up. It came up a little bit and then would drop and go up and down. And basically, with strong pain meds like opiate pain meds, those will drop your blood pressure as well. So for the first few days after surgery, I didn't have any pain meds, which it was pretty painful, but I understood why that was happening, and I just kind of dealt with it, and it was hard. That's really the only way to put it. I remember talking to my husband and I talked to my uncle and just being like, I feel like I legitimately got hit by a bus. I feel like I got filleted and hit by a bus, and here I am. So first few days after surgery were tough. I was in the hospital. I had nursing and everyone around. I am so grateful for the people that have been there for me through all of this, because it was a lot. It really was. It was the hardest thing medically that I've ever done. And I hope I never have to do anything that big ever again. I am hoping that doing this surgery was the thing that will prevent me from doing anything even more difficult, medically speaking. It was a lot. I definitely mourned the change in my body. Things look different. I didn't realize I would be as upset or mourn my old body as much as I felt, because I was very excited about this surgery. My surgeon did not only an amazing job with the deep flap reconstruction part of things, she also repaired the diastasis recti that I had. So I had about 2 to 3 centimeter gap between my abs, top to bottom, and she sewed all that up. And holy, is that a painful recovery. Wow. And with the combination of having a breast surgery and an abdominal surgery, I really couldn't use my arms or my abs to get myself up. So I had to have help with literally moving. It was a lot. It was a lot to be reliant on someone else 100% of the time. Like, I needed my husband to move the power recliner enough so that I could like roll out of it instead of using my arms or my abs or anything. So being that dependent on someone was eye-opening. It's really hard to deal with, especially when you're used to being independent. So for anyone that has ever had to deal with that, I feel you, and it's a lot to process. It's a lot to deal with. So now I'm 6-7 weeks out of surgery and finally getting back to feeling more normal, feeling more like myself, being able to stand up straight finally. Guys, I had to be crouched, like just totally hunched over for really the first week was the worst, and you could kind of straighten up, but even just walking a little hunched, man, that'll make your back hurt if you're not used to that. I'm used to standing up straight, and I couldn't do that because literally my stomach muscles and my skin were so tight that I just couldn't, and I didn't want to risk ripping open the stitches. I have a huge incision. I'll insert a picture, just basically like flank to flank. It's long. And of course, when you take out a bunch of skin, you got to move around the belly button. So I got a little scar around the belly button too. And what I realized was I actually miss my little stretch marks that I had after having kids. Those are my tiger stripes. And I have one little tiny spot left that was above my belly button and is now like at the bottom of the scar. One thing I do want to add here, I am incredibly grateful for the aesthetic results that I have after the surgery. That still doesn't negate how hard it was, and processing the difference in what my body is versus what it was. And there were things about my body I didn't like before that I like more now. It's just how life goes. And I think one thing that I really needed to think about myself is you don't realize what you have till it's gone sometimes. And I just didn't realize I actually really loved my little stretch marks that were my tiger stripes, and I mourned them for sure. I am so grateful to my entire healthcare, my surgical team, to where I am now. I just want to say that it is okay to grieve what was and still also be happy with what is. I'm really grateful that I have been able to take control of my health in this way. I'm really grateful that I found out about this mutation, that I know what to do in terms of screening, that I was able to do something preventive. I know that not everyone gets that option. Sometimes these kind of cancers, they just come up out of nowhere and you didn't expect it. I just want to talk for a second about screening and doing genetic screening when needed. There are certain criteria for genetic screening. It's really the rule of 1, 2, 3 for hereditary breast and ovarian cancer. And there are certain things that may surprise you. Things like one diagnosis in the patient or a first or even second degree relative of any of these listed things. Breast cancer at age less than 50 years, ovarian cancer at any age, a triple negative breast cancer at age less than 60 years, a male breast cancer at any age. The list goes on. I say this to say that there are actually a lot of instances for people to get genetic screening. Being able to talk to your primary care doctor about what your risk factors are, knowing your family history well enough that you can say there's this cancer history or that cancer history and what does that mean for genetic screening, and then getting that screening done. Super important. Honestly, that can save a lot of lives. I put this up on the screen so you guys know when you should be tested and when maybe it's probably not worth it. I think the more you know, the better. That truly, honestly, is my philosophy. So what now? Y'all, I'm back on YouTube. I'm here. I'm going to be doing more Doctor Reacts, more informative videos. If there are any specific topics y'all want me to talk about, I'm happy to make more videos on that kind of stuff. This has been a seriously humbling experience. I'm so grateful to be back and feeling good that I am here and made it through such a big thing and can share with you guys everything I experienced and lend some support to people, anyone who needs it out there. Y'all, thank you for bearing with me through this brief, not so brief intermission from my YouTube channel. I'm back. I will be having at least one more surgery, just some minor revision stuff, but nothing as big as what I've had, and I definitely won't be away for as long. We're getting back into it. Next video should be coming in the next week or two. It will be a Scrubs reaction video. Stay tuned. I'm so excited. That video I actually did film before my surgery, and I just have not had the brain capacity to edit it. Finally going to be editing it in the next week or so stay tuned for that. Y'all, thank you again for your support. Thank you so much for joining me. I'm JessTheMD. I really enjoyed spending time with you and telling you a bit about what's been going on in the last couple of months. Thank you for joining me. I can't wait to see you again. It was so great to see you, and I will see you in the very next one. Bye.